All right, let's go ahead and bring in, let's put on for the screen our categories for today. Yes, the correct ones. Hey y'all, hey. Okay, I'm going to give y'all like a minute or two to come on in the room. Welcome to NCLEX Jeopardy Thursdays with me, Nurse Sam. This is where we do our comprehensive NCLEX review for RN and / or PN. Okay, practical nursing or vocational nursing if you're in Cali or Texas. How y'all doing today? Hey, hey, hey. How are y'all doing today? Y'all week going? Your week going okay? Is your week going okay? We're almost done. We're almost done with this week. It's Thursday, Friday Eve, and then it's the weekend. I know that's right. Hello, hello. Hi, The Worthy Journey. Black Buddha, what's up? I've been waiting for you to come live. My bad. But I am here, guys. All right, so like I said, this is our NCLEX Jeopardy, our live NCLEX review for RN students and LPN / LVN students. Okay, as you can see here, it is real Jeopardy style. Okay, and blue screen, we have 5 categories, 5 questions per category, all ranging from 100 points to 500 points. Okay, so we have a total of 25 questions. We won't get through our 25 questions with me and you. We're going to actually get through about 5 on live. And then if you want to take the rest of the 20 questions or the complete 25 questions, you can download the free app. The app is The Nurse Sam. Okay, you can download the free app and then play the full NCLEX Jeopardy mobile game once we get finished with this. All right, so you get 25 questions every week. If you download the app and play the NCLEX Jeopardy mobile game. All right, so that's 25 NCLEX practice questions weekly. Okay, you can't beat that with a stick. All right, so let's go ahead and get started. As you can see, these are our categories: Pharm, Pediatrics, Mental Health, Fundamentals, and Adult Health / Med-Surg, Patho, whatever you want to call it. Okay, so we are going to get started. What's going to happen, how it's going to work. If you guys have not been here the last maybe 1 or 2 times, can't remember. But we now can see the questions on the screen. Okay, so just like you're seeing this blue board right here, you're going to be able to see the questions and the answer choices in addition to me reading it out loud. Okay, in true Jeopardy style fashion, when I read the question or when you're ready to answer the question, you have to say what is. Okay, so once again, we are playing for points. Okay, this is an incentivized NCLEX review. That's why we kind of have our point system. It's just a really fun and less overwhelming way to study for your NCLEX and review for the NCLEX without feeling like you're going to have a panic attack and throw up each time. Okay, so this just makes it a little fun. And we reward you guys with a free study kit with whoever gets the most points. Okay, so here's how you get those points. Like I said, I'm going to read the question. You're going to read the question. You don't have to answer. You don't have to wait for me to finish reading the question to answer. If you read the question, when I bring it up, you read the question and you know what the answer is. Go ahead and answer. You have to say what is and then whatever that answer is going to be. You have to be the first person on my screen to answer correctly. And obviously you have to answer correctly. Okay? Just in case you experience some lagging, you can exit out the live and then come back in. What's it? XC saying? Good luck. Good luck to you. You say your NCLEX is tomorrow. Good luck to you. Make sure you let me know how you do. All right, guys, so let's go ahead and get started. Like I said, I'm going to pick a question from each category. We're going to play for points, obviously. Let's go ahead and start with, I have to get my scoreboard out. All right, let's go ahead and start with adult health for 100 points. Here you go. All right, so It says, the nurse is assessing a client 24 hours following a cholecystectomy. The nurse notes that the T-tube has drained 750 milliliters of green-brown drainage since the surgery. Which nursing intervention is most appropriate? 1, clamp the tube. 2, irrigate the tube. 3, document the findings. Or 4, notify the primary healthcare provider. Do not forget, this is NCLEX Jeopardy, so you have to say what is prior to answering, or your score or your answer will not count as correct. All right? Like I said, that whole what is thing is just because we're playing the Jeopardy style version of it. On the actual NCLEX, you don't have to put what is. Okay, but we're just staying on theme. All right? All right. All right, so I'm seeing 2s and 3s. I'm seeing 2s and 3s. 2s and 3s. And you can say what the number is. You can say like for example, Carolina, you said what is clamp the tube. You can say what is 1. You'll cut off, you'll save a bunch of seconds doing that. All right, so let's go ahead and see what our answer is. Adult health for 100, and the answer is, drum roll please. That was a second drum roll. Let's go. What is 3? Document the findings. What is 3? Document the findings. All right, rationale says, following cholecystectomy, question, what is cholecystectomy? That is a surgical removal of what? All right, using our prefixes and suffixes, knowing those are our medical terminologies. Ectomy means surgical removal of. Cholecyst is what? What does that mean? Cholecystectomy is the surgical removal of what? The gallbladder. Great job, Carissa. All right, so this client had, it says following cholecystectomy, aka following the removal of the gallbladder, okay? Drainage from the T-tube is initially bloody and then turns a greenish brown color. The drainage is measured as output. The amount of expected drainage will range from 500 to 1,000 milliliters a day. The nurse would document the output. All right, so since we know that this is surgical removal of the gallbladder, and, you know, the drainage is going to be initially bloody, obviously, because blood, and then it's going to turn a greenish brown color. All right, most likely, what is that greenish brown color? Why is that not cause for concern? What is that greenish brown color that is drainage that you would expect to see after removing a gallbladder? Thank you again, Carissa. Bile. And I think it was Binta Kib that said bile on the first question earlier when I asked about gallbladder. But I think you were talking about the greenish brown. So thanks to you guys both for answering that one first. But everyone else is saying bile. Great job, great job, great job. So yes, that is why all we're going to do is document the finding, because it's an expected finding. All right. Make sense? Who was the first person to answer that correctly? What is 3? Let me scroll up. First person to get that is Carissa Pierce. That's funny because you've been answering the other questions first as well. Awesome job, Carissa. All right, Carissa Pierce. Great job. You are now on the scoreboard with 100 points. Who else got what is 3? Benta Kip, great job. Shade, Jaw, NJD, Fearless Nage, Boy Shorts, and Lip Gloss, Alexis Lachey, Jersey, Nikki 1318. This is not, that wasn't a select all and apply question. You said 3 and 4. That one's not select all, so you would just have to put 1. All right, great job, everybody that got that. Remember, just because you were not first, or just because you didn't say what is, does not mean that you're gonna do bad on the NCLEX. All right, as long as you are answering the questions correctly, that means you are comprehending, so you are doing well. Okay. All right, so let's go ahead and get into our next question. That was adult health. Now let's go into fundamentals for 200. Fundamentals for 200. All right. All right, it says, a client treated for an episode of hyperthermia is being discharged to home. The nurse determines that the client needs clarification of discharge instructions if the client states a need to perform which action. 1. Increase fluid intake. 2. Resume full activity level. 3. Stay in a cool environment when possible. Or 4. Monitor voiding for adequacy of urine output. This is fundamentals for 200, guys. Let's go back and see my tips after you read the question. Well, obviously read the whole question and read the answer choices. Go back and read that last question so you can really understand and really comprehend what the question is asking of you. Okay, so going back to the question that says, the nurse determines that the client needs clarification of discharge instructions if the client states a need to perform which action. All right, so let's go ahead and get into what our answer is. All right, the question said that we're looking for the discharge instruction from the client that would indicate a need for further clarification. All right, need for further teaching, need for further clarification, need to get it through their brain again. However you want to say it, it means that they do not have a full understanding of the correct discharge instructions. So if they're saying which one would indicate a need for further teaching or a need that you need or all the reason for you to further clarify for this client, you're looking for a statement that's incorrect or false. Okay, so which one of these is something that's false or something that's incorrect, that if they said that to you, you'll be like, no, that's wrong. You clearly don't get it yet. That's okay. Let me repeat myself. Let me further clarify. So the answer to that question is, what is 2? Resume full activity level. Resume full activity level. All right. That is going to be the answer. It says discharge instructions for the client hospitalized with hyperthermia include the prevention of heat-related disorders. Okay, remember hyperthermia means hyper means above or increase, and thermia means temperature. All right, so hyperthermia would be increased heat. Okay, almost like a heat stroke, basically. Think about that. So you want to prevent them from getting hot even further. All right, so what can we do? Increase fluid intake for 24 hours. Self-monitoring of voiding. Make sure that their output is adequate. And the importance of staying in a cool environment and resting. That's going to be all the things that you want them to do. All right. However, resume full activity level is not what you would expect them to do right after being hospitalized for basically overheating. Okay, you want to take it slow. You want to rest, boo. You don't want to just get out there, especially if they're full. Like, let's say this is what's one of those people that box? Floyd Mayweather. Sure. Let's say this is Floyd Mayweather. All right, and they was just he was just hospitalized for hypothermia. Not gonna let it's not happening, but let's just say that was their occupation. Are you gonna tell Floyd Mayweather that after they were just hospitalized for 24 hours to go back and resume full activity? They're going to be right back. They're going to be right back in. Okay? So kind of think about that. So once again, you were looking for the answer that was incorrect. All right? Resume full activity level right after they're hospitalized for overheating. That's not what you would want them to do. All right? First person to get what is 2 is Carissa Pierce. Carissa, you are on it. You are on it. I don't know what kind of connection you got, but congratulations. You are already on the scoreboard with 100 points. You just got this one correct in first, so you just got another 200. So now your score is 300. Great job. Who else got what is 2? Just 10, Benta Kib, Nurse Cole, Smiles, NC Pink Rose, Addie, Alexis, A Little Fine Girl, Fargrove, DS Hung, Sue X4. Great job. Awesome job. Katie K! Woohoo! Okay, just had to take a screenshot. Great job, Katie K. She said, checking in to let y'all know that I passed my exam today with 75 questions, period. Period. Great job. Super, super proud of you. Ooh, it's giving new nurse energy. It's giving new nurse energy, and I love it. Awesome job. All right, great job, guys. Let's go ahead and get into our next question. And this one is going to be mental health for 300. Mental health for 300. Kitty said I had 35, select all that apply. I think like so did I. But you passed, so great job. All right, so mental health for 300, it says, the nurse preparing to admit a client with a diagnosis of obsessive compulsive disorder to the mental health unit should expect to note which behaviors in the client. 1, sad and tearful. 2, suspicious and hostile. 3, frightened and delusional. Or 4, rigidness in thoughts and inflexibility. What is going to be the behaviors, the expected behaviors in a client with obsessive compulsive disorder, aka OCD? Would you expect them to be sad and tearful? Would you expect somebody with OCD to be suspicious and hostile? What about frightened and delusional? What about rigidness in thought and inflexibility? Remember what obsessive compulsive disorder is. All right. Okay, so the answer to that question is what it's for. Oh, I just love when we all get it right. You know, it's given, I'm going to pass too. Okay. Awesome job. All right. So it says what is for rigidness in thoughts and inflexibility. All right. Those are characteristics of the client with OCD, obsessive compulsive disorder. Clients with this disorder usually are not hostile unless they are prevented from engaging in the obsession or compulsion, because this behavior is what decreases the anxiety. All right, none of the other options are associated with OCD. Okay, so yes, rigidness in thought and inflexibility. They have like a set way of how they like to do things. If it's like they like to ring the bell 3 times before going out the door, it has to be 1, 2, 3, and then they go out the door. It can't be 2 times. It can't be 4. Okay, and then if someone tries to prevent them from ringing the bell before they leave, I guess they're just not leaving because, once again, inflexibility. That is what they have to do in order to get out the door. This is just an example. And anyone that prevents them from completing this, like, it's not a tick, but completing that activity, I'll just say that, then they can get a little hostile, as it explained earlier. All right. Who's the first person to say what is for? I saw it, but then I forgot what it was. Wait for it. Scrolling back up. Just 10. Just 10. Great job. All right, so just 10. You are on the scoreboard with 300 points and tied with Carissa. Awesome job. When I say, like, I think literally everyone said what is for. Snaps for everybody. I love it when we all get it correct. All right. And y'all know I love to call everybody out that's gotten the answer correct, so they can feel that sense of not really validation, but so you can also know that you are just small wins built up into big wins. Okay. So I like to acknowledge everyone, especially the ones that are participating. Love y'all. Thank y'all. So who all got what it's for? Just 10. The first person to get it, future ER nurse, Tori Sosa, Carissa, Sassy, NC Pink Rose, Ty, Raquel, Smiles, flawfully beautiful. Unknown Beauty, Chasing Nurse Dreams, D.S. Hung, Tay Nicole, Life as I Know It, Binta Kib, Miss Lulu. Great job. Unknown said, girl, I had a patient who had to flick the lights a few times and walk out the room. It definitely was giving Bloody Mary. I wasn't with it. That's funny. That is funny. All right. Next question. That was mental health, right? It sure was. All right, pediatrics. No. Yeah, pediatrics. Yeah. All right. In caring for a child diagnosed with Hodgkin's disease, which oncologic? Is it oncologic? Sure. Which oncologic emergency should the nurse be most concerned about? 1, hyperleukocytosis. 2, spinal cord compression. 3, superior vena cava syndrome. Or 4, disseminated intravascular coagulation, or DIC. What is our answer? All right, we're caring for a child that's diagnosed with Hodgkin's disease. All right, which oncologic emergency, cancerous emergency, I know what oncology means, should the nurse be most concerned about? Should the nurse be most concerned about? All right, hyperleukocytosis, spinal cord compression, superior vena cava syndrome, disseminated intravascular coagulation. All right, let's look at what that answer is. What is 3? Superior vena cava syndrome. Great job. Only one person got that, and that was Unknown Beauty. What's up, Chriselle? Great job. So Unknown Beauty, you're the person that got those points. Unknown Beauty just got 400 points. Unknown 400. Great job. Great job. Don't feel bad, because I got that thing wrong too. I got that thing wrong too. I'm scroll up. Future ERners, I don't see yours. I am Addie. I don't see yours either. Dang, but great. As y'all know, y'all got it correct. Awesome job. So, future ERners also got it, and I am Addie. Great job. If you got what is 4 or what is 1, don't feel bad. I also got it wrong when I originally did this. But let's go over it together, okay? So it says pediatric oncologic, whatever, emergencies include tumor lysis syndrome, hyperleukocytosis, superior vena cava syndrome, spinal cord compression, and DIC. Now, it says, because Hodgkin's disease causes a space-occupying lesion in the chest, superior vena cava syndrome is the most likely emergency that will occur with this type of malignancy. All right, so this specific complication could lead to airway compromise and respiratory failure. All right, the other complications are possible due to issues with either immune response, treatment response, and obstruction, but they are less likely to occur due to the location of the lesion in Hodgkin's disease. Okay, so you know how the question said which one is the most likely to whatever. That's the this is why. Okay, you want to think about your ABCs, but you also want to think about the actual type of cancer that the client had. Okay, Hodgkin's disease. All right, what is Hodgkin's disease? All right, now remember, there's a space-occupying lesion in the chest. So if you already have a chest that's at lower capacity due to the Hodgkin's disease, having superior vena cava syndrome. Superior vena cava also in your chest supplies the heart. Okay. Having superior vena cava syndrome is also going to, well, that's good. Out of the four, that one's going to lead to the most injury. Let me say that. That one's going to lead to the most injury due to the location of the Hodgkin's disease already being in your chest. Okay, does that make sense? All right, and that's going to, once again, ABCs lead to airway and respiratory issues, lead to respiratory failure. Airway is always first for ABCs. Think about that. Okay. Did I do your points? Yes, great job. Let's go into our next question. Which one is the next question? Wait for it. Okay, cool. Right here. This is actually pharmacology for 500. My bad. All right. A client with psoriasis is being treated with calcipotriene cream. Administration of high doses of this medication can cause which side or adverse effect? 1. Alopecia. 2. Hyperkalemia. 3. Hypercalcemia. Or 4. Thinning of the skin. A client with psoriasis is being treated with calcipotriene cream. Administration of high doses of this medication can cause which side or adverse effect? Ooh, it's giving 3s or 4s. It's giving 3s or 4s. Ooh, this is good. This is good. All right. Y'all ready to see what the answer is? And the answer is, General, please. What is 3? Hypercalcemia. I know. I said 4 too. I said 4 too, but I was thinking about eczema, not psoriasis. But anyway, we're gonna get into why it's hypercalcemia and not thinning of the skin. All right, so calcipotriene, all right, that is an analog of vitamin D3. All right, calcium, calcipotriene. Kind of think, link that. I didn't in my head. I did not in my head, but that's why I'm telling you to do it. Okay, and that specific cream is indicated for mild to moderate psoriasis. Now, responses are equal to those achieved with medium potency topical glucocorticoids or topical steroids, all right, which is what I was thinking. And the most common adverse effect is local irritation. However, the question said, which would be the adverse effect or side or adverse effect that would happen when you have high doses of calcipotriene? So high doses of calcipotriene, which is an analog of vitamin D3, you're going to get hypercalcemia. All right. Now, the important thing about this specific medication, which I did not know, but now I'll know forever because I got this question wrong, is that unlike glucocorticoids, like the topical ones, unlike those steroids, calcipotriene does not cause thinning of the skin. That's really the key here. That is really the key here. Okay, because we all thought thinning of the skin means put too much steroid on. It can cause thinning of the skin. But A, this isn't a steroid. B, it's an analog of vitamin D3. All right, if it was high doses of glucocorticoids, then yes, thinning of the skin would be, the most likely adverse effect. But since this is not a glucocorticoid, 1, and 2, this does not cause thinning of the skin. Unlike those glucocorticoids, at high doses, calcipotriene has caused hypercalcemia, and that can kind of just if you have high doses of a calcium vitamin D3 analog, you're going to have high doses of calcium in your blood. All right. Alopecia and hyperkalemia are not associated with this medication. Okay. I don't know what I have no idea what any of that says. If anybody can translate that, that'd be great. I don't know what that says, sir. Or ma'am. I'm so sorry. Yeah, I don't know. Ooh, I don't know. I took Swahili and Latin in high school and college. I know. I don't know what that says. I'm so sorry. All right. So does that make sense? It says C. Then I started looking at the similar answers like it must be one of them. Never heard of it, but sounds like calcium to me. Right, exactly. That's exact. Listen, sometimes you gotta go by. That's called an educated guess. You hear me? All right. So great job to everyone that said what is 3. First person though on my screen to get what is 3 was Carissa Pierce. Carissa. All right. So Carissa, you just got an extra 500 points. That's supposed to be 500. So you now have a score of 800 points. Snaps for you. All right. Great job. Who else didn't let this get them? It's okay to everyone else that got. I got too. So I'm not even calling my name. Okay. Carissa got it. Smiles, Unknown Beauty, Fargrove, DS Hung, Malicious, NICU Nurse, Benikip said, what is, I don't know. Negative, ghostwriting. Emmy got it. Lilette got it. Great job. ID cat. Nurse Cole, you got it? I didn't see yours submitted here unless I scrolled by too fast, but I didn't see it. But great job if you got what is 3. Awesome job. Okay. So, if you didn't know what calcipotriene was, now you do, okay? If you ever get this again, calcipotrienes for psoriasis. It's an analog of vitamin D3. It sounds like calcium. And it does not cause thinning of the skin, okay? Let that kind of sink into it for you. Let that sink into your mind, okay? All right, so... Wait for it. Let me just grab my next one. Well, actually, that was actually it. Yeah. All right, guys. So we actually had a shorter game today, a live version of the game. So that means that our winner of tonight's game was Carissa Pierce with a grand total of 800 points. Unknown Beauty, you had 400, and then Just 10, you had 300. Great job to everyone that came and participated and played. Carissa, congratulations. You have won a free digital Ultimate Nursing School bundle. All right, that is our 400-page bestseller for any person that's either in nursing school, just graduated, or studying for the NCLEX. So DM me your full name, first and last, as well as your email address. Okay, so I can send you your prize. You can keep it digital. You can print it out, either professionally or print out certain sections. It's completely up to you. However, you want it for free. It's regularly $97, but you just want it for free for participating and winning. All right, so if you guys had fun and you love these type of questions, there's a couple things that I want you to do. Come back next Thursday, because we do this every Thursday at 7 p.m. We go through a few questions, and then the rest of the questions, like I said, it's 25 new questions weekly. All right, for the NCLEX, just like, okay, Jay's about to say, for the NCLEX Jeopardy, their mobile app, yes, the app is not called NCLEX Jeopardy Mobile. The app is actually right up here. It's called the Nurse Sam, all right? It's actually within my app. All right, it's a free app, the Nurse Sam, and when you click on that free app, you're gonna go to NCLEX Prep, just like it says right here, and then this little widget that you see right there that says NCLEX Jeopardy Mobile, that's where you're going to play. All right, it's our app exclusive mobile Jeopardy game. All right, and you can play all 25 questions when you download the free app and then play NCLEX Jeopardy. All right, you'll be able to play all 25 questions. Either by yourself or with a group. You'll be able to control it, interact with it, all that great stuff. But free to play, free to download. It's my gift to you every week. Okay? This replay and other replays from NCLEX Jeopardy are going to be on my YouTube page. All right, my YouTube channel. So if you want to check out the ones that we have already, you can go to thenursesamtv.com. It's going to lead you to my YouTube channel. Make sure you subscribe so that you can get notifications of when we upload this replay plus a few others. All right, that's going to be found once again on my YouTube channel. Subscribe if you have not, thenursesamtv.com. Okay, make sure you download the app to play the rest of the 25 questions, which I'm about to update now. And then make sure you come back next week at 7 p.m. right here on my Instagram Live so we can go through even more questions and have even more fun with our NCLEX review. Okay? P. Hargup, you did not win, love. Carissa won, but if you were getting the answers correct, you won in the long run. Does that make sense? All right, so thank you guys so much for joining me. Like I said, download the app to play the rest. Subscribe to my YouTube channel, thenursesamtv.com. What's the rest? And see me next Thursday at 7 p.m. Absolutely. If you guys have not gotten your Ultimate Nursing School bundles, make sure you do so. Okay, you can use code to get 40% off for coming. Hold on one second. Wait for it. I'm gonna give you a discount for coming that you can use on any study kit. If I were you, I'd use it on the Ultimate Nursing School bundle. You can go ahead and get, wait one second. Nurse 40. Use code NURSE40 for 40% off any and all digital bundles. Nurse 40 for 40% off. There you go. Nurse 40 for 40% off. All right, if you have any questions, hit me up. I'll see y'all next time. Love ya.